Healthcare reform is still the top issue up in Washington, and as doctors and nurses and hospital staff, what goes on in Washington can directly affect how you do your work. Just this last week, the Senate brought to the floor a doc fix bill to address the looming 20% cut in Medicare reimbursements to physicians. This is a problem that plagues Washington every 6, 12, or 18 months, and it is time for a permanent fix to these cuts. The Senate bill failed, and while I do not want to see these cuts occur, I believe the Senate bill was the wrong solution to the problem. Another bill, 3693, that will make the needed permanent fix, I'm hopeful that this bill will become law. In the House of Representatives, we heard this week that Speaker Pelosi has the votes to pass a robust public option. Then the very next day, we heard she does not. Now, I oppose the public option, and I believe there are better ways we can get America's uninsured health care insurance. I remain concerned that none of the bills being seriously considered in the House or the Senate contain any type of medical liability reform. President Obama has proposed demonstration projects, but we know here in Texas that those are not necessary. I realize that this isn't the silver bullet solution to all of our problems, but the successful results here in Texas prove that medical liability reform will make a huge positive impact, just like it has here at home. Right now, Democratic leadership in the House and the Senate, their staff, the Obama administration, are all busy putting together the different bills to get ready to send to the floor. I have heard from Democratic leadership that the bill may be brought to the floor by the first week of November, maybe the third week of November, or maybe even the day before Christmas. The Senate will likely be a couple of weeks behind the House with regards to timing. So there are still a lot of moving parts and much more to come in healthcare reform. I have a website devoted entirely to the healthcare reform issue, www.healthcaucus.org, so I encourage you to visit that site for timely information. As I said earlier, as doctors, nurses, and hospital staff members, what goes on in Washington with healthcare reform directly affects you and the work that you do. So I encourage you to stay involved and up to date on the latest news. Thank you.